Hello, and welcome to the PPI Ignite Network. This video is designed to give you an idea of what our network is about, what it aims to achieve, and how you can get involved to promote public and patient involvement, better known as PPI. PPI in research means research undertaken in meaningful partnership with the people most likely to be affected by research results. It's the PPI Ignite Network's goal to build capacity for PPI across Ireland and change the research ecosystem in Ireland by embedding PPI nationally. The PPI Ignite Network is the coming together of 7 universities and 10 national partners. Each of us tries to champion and build capacity through training and education within our individual universities around meaningful PPI. Each of us also has local partners. In the case of UCC, local partners they work with include research charities, patient organizations, community organizations, and research groups, all with an interest in developing patient voice. The breadth of local partners builds lead sites expertise as we look to share knowledge and exchange experiences as we work in the network. As well as these local partners, we also have 10 national partners, bringing a very wide mix of voices and influences to our work, including 2 umbrella organizations for patients, HRCI and IPOSI, 2 other universities, Queen's University Belfast and Maynooth University. Additionally, we have TUSLA, the Child and Family Agency, 2 groups involved in postgraduate education and research, Sphere and the HRB-TMRN, Campus Engage, which is focused on promoting community engagement across universities, the Research and Development Division of the HSE, and an international collaboration with ICPHR, bringing global perspective to our work. Each national partner has its own focus in different ways, resulting in broad expertise across the network. Together, we deliver on the PPI research agenda in Ireland. The national office is based in University of Galway. Led by Professor Sean Deneen, a diabetes doctor, the focus of his research is on co-developing a novel young adult diabetes care program, working with the young adult panel. The National Program Office works collaboratively with our lead sites, partners, and advisory boards to achieve the network's objectives. Each of the lead sites has a site lead or co-leads. The mix of backgrounds of this experienced group of academics demonstrates the wide range of areas in which PPI is being brought to the table, including nursing, speech and language therapy, strategic planning and human-centered design, preclinical research, aging and intellectual disability, epidemiology, psychology, and public health. In each university, there is a program office with a program manager, who are developing PPI across the university, delivering education and training to students and researchers locally, and working with PPI partners in their local areas. Program managers play a critical role in the network, working across institutions to make it easier to do PPI and collaborating across the network to drive its work. Our Public Advisory Board brings the voice of the public and patients to guide the strategic developments of the network. Established in May 2022, the diverse members of the board are from across Ireland and draw on a wide range of personal, professional, PPI, and community-based experiences to advise the network on how to best achieve its goals. Members of the network's external advisory board bring their in-depth knowledge and direct experience in the involvement of public, patients, and communities as research partners. The board advises and provides strategic development to the network leadership and management. The network objectives guide us on what we do, looking to further improve PPI approaches and promote meaningful partnerships. We're working to promote PPI at an institutional level and in the national research ecosystem. We hope to create a nationally coordinated and internationally recognized network of PPI excellence. We aim to share a shared voice of PPI that isn't dependent on one institution. Finally, our long-term objective is to improve people's health and to enhance healthcare delivery through embedding PPI in our research. PPI spectrum of involvement to show what we consider involvement in research. We support researchers to develop their expertise and choose approaches that are appropriate to the area they're involved in and their skill sets. Along with the work going on in each university, we have 5 work packages across the network, including working with our local and national partners. Our first work package focuses on education and training and delivers many education and training events and other shared learning opportunities across the network. Work Package 2 focuses on embedding PPI in undergraduate and postgraduate education, aiming to embed PPI as part of the normal research methods of our future research leaders. Work Package 3 looks at embedding PPI within universities and across the research ecosystem nationally, trying to identify and, as far as possible, remove barriers to involvement. Work Package 4 aims to promote PPI excellence and to encourage a focus on quality improvement in our approaches. Finally, Work Package 5 is about building a strong national PPI network and focuses on network expansion. Much of what we do is communicated through our online hub, which has become a port of first call to check out information about PPI in Ireland. We invite you to come here as a starting point to follow what we're doing. There are a lot of different PPI events happening throughout the country. The calendar of events lets people know what PPI events are happening, with registration links for events hosted by the network and beyond. The Our Work section details the activities and impact of the network through case studies to give a flavor of the variety of work that's been undertaken in the network, looking at what works and where we have room for improvement. Our Resources section includes a variety of resources to cover all aspects and phases of involvement in research. Please browse our resource repository. Finally, we have our Get Involved section, encouraging you to register with us as a way to receive regular newsletters and generally be connected into our network. Here you can also find our PPI Opportunities Notice Board, which allows researchers to share opportunities and gives an open space for PPI contributors and partners to connect up with them. A good example of the breadth of the network's ability to bring communities together is our National PPI Festival. Hosted annually in October, the festival is a means by which to build connections, champion PPI, and more broadly celebrate the progress to date. Last year's festival was hosted from the 1st to 31st of October and saw over 60 events hosted by a variety of public, patient, and research groups, both within and outside of the network. In all, some 2,800 attendees joined last year's for in-person and online events, spanning a wide range of applied sciences including thrombosis, neurodiversity, gene editing, mental health, health literacy, radiation therapy, dementia, cancer, Parkinson's, and many more. To learn more about the National PPI Festival, I encourage you to go to our online hub where you can learn more. Finally, here's contact points for each of our program managers. Here's our website, and you can also follow us on Twitter. Thank you very much for taking the time to listen to us, and we look forward to you joining our PPI journey.